Federica Mascaro, a medical oncology resident at Policlinico San Matteo of Pavia, currently working at Istituto Nazionale Tumori in Milan, Italy. Today, I'm very pleased to present our multicenter retrospective study titled Clinical Outcomes in Stage 1 Seminoma Patient age greater than or equal to 45 years, according to treatment modality. Let's start with a brief overview. And testicular germ-cell tumors represent the most common solid malignancy in males age 15-40. Approximately 80% of patients are diagnosed with a clinical stage 1 seminoma disease confined to the testis and associated with an excellent prognosis. Indeed, in this population, 5-year survival rates exceeding 99%. Standard management options for stage 1 seminoma include three main approaches: active surveillance, adjuvant chemotherapy with a single cycle of carboplatin, or adjuvant radiotherapy targeting the para-aortic with or without ipsilateral iliac lymph nodes. As already specified, seminomas typically affect younger men, while cases in patients over the age of 45 are relatively uncommon. As a result, data on survival outcomes in this population remain limited, and this study aimed to investigate the clinical outcomes in this specific subgroup of patients according to the different treatment modality received. So, in our study, we retrospectively reviewed data from 182 patients age 45 years or older, diagnosed with stage 1 seminomatous testicular germ-cell tumor between 1992 and 2023. The median age was 49 years, and patients were managed with standard options described in the previous slide. Specifically, among the 182 patients, 120 received active surveillance, 45 underwent chemotherapy, and 17 were treated with radiotherapy. Most patients, 54%, were age 45-50 years, followed by 41% age 51-65, while only 5% of patients was over 65 years. As you can see, active surveillance was the most frequent approach among all age groups. And after median follow-up of 60 months, the 5-year progression-free survival rates were 83% for active surveillance, 91% for chemotherapy, and 76% for radiotherapy. Relapses were more frequent in the radiotherapy group compared to active surveillance and chemotherapy. Respectively, the percentage of relapse was 29 versus 15 versus 9%. Despite of these differences were not statistically significant, and most importantly, the 5-year overall survival was 100% in all treatment groups, and all patients whose relapse were successfully treated. Our findings confirm that all the patients with clinical stage 1 seminomatous testicular germ cell tumor share the same favorable prognosis as the general stage 1 seminoma population. And despite slightly higher relapse rates in radiotherapy group, non-survival disadvantage was observed. This reinforces the safety of active surveillance even in older patients and supports individualized treatment decision based on patient preference, comorbidities, and toxicity concerns. In conclusion, our study highlights the excellent outcomes in older stage 1 seminomatous testicular germ cell tumor patients, regardless of the treatment modality chosen. This real-world data may assist clinicians in shared decision-making and reassure patients who wish to avoid an overtreatment. Thank you for your attention.